Graves' disease is an autoimmune disorder that causes an overactive thyroid, otherwise called hyperthyroidism. Autoimmune disorders are when the body's own immune system attacks its cells rather than protecting them. With the disease, one's immune system attacks the thyroid and causes it to produce more thyroid hormone than the body needs. The thyroid is a small, butterfly-shaped gland located in the front of one's neck. As a result of Graves' disease being an autoimmune disorder, no two patients will be the same in terms of the way they acquired the disease and the symptoms they present. Poor digestive system health is commonly associated with autoimmune disorders. Food allergies, especially gluten, can also be a root cause. People who have a family history of Graves' disease are more susceptible to acquiring it during their lifetime. Women are more likely than men to be diagnosed, and it typically develops in people under the age of 40. A blood test is used to determine the patient's level of thyroid-stimulating hormone, which is the pituitary hormone that normally stimulates the thyroid gland. Patients with Graves' disease usually have lower levels of the thyroid-stimulating hormone. A separate blood test will also be performed to measure the levels of the antibody known to cause Graves' disease. Graves' disease can also be diagnosed through a radioactive uptake scan, ultrasound, and imaging test. With the disease comes a variety of complications including pregnancy issues, heart disorders, brittle bones, and thyroid storm. Thyroid storm is rare but occurs when there is a sudden increase in thyroid hormones which cause adverse side effects such as fever, sweating, vomiting, weakness, seizures, jaundice, severely low blood pressure, and possibly a coma. Graves' disease can be treated in a variety of invasive ways, such as through a thyroidectomy, which is when the patient's entire thyroid is removed through surgery. All their thyroid functions will then be artificially ingested through medications. The medication will need to be taken for the remainder of the patient's life. Another invasive treatment is radioactive iodine therapy, which is also referred to as radioiodine. It's a commonly used treatment. The thyroid needs iodine in order to produce hormones. The radioiodine goes into thyroid cells, which then radioactively destroys the overactive thyroid. Over time, the thyroid gland will shrink and symptoms of the disease will lessen gradually over several weeks to months. According to a 2016 study, Graves' disease cannot be cured by eating or avoiding certain types of food, but some nutrients and minerals play a role in managing the underlying condition. Diet can affect both the production of thyroid hormones and how the thyroid functions. Such nutrients and minerals include calcium, iron, and iodine. Calcium and vitamin D are vital for patients with Graves' disease. It has been found that hyperthyroidism can cause problems with bone mineral density and increase the risk of bone fracture. Foods rich in calcium include cheese, yogurt, broccoli, and kale. A diet rich in calcium and vitamin D can significantly increase the patient's bone mass, according to a 2012 study published to the Indian Journal of Medical Research. Iron is a nutrient that is important for normal bodily processes, including thyroid health. Iron helps the red blood cells carry oxygen to other cells in the body. Foods higher in iron include raisins, black and white beans, spinach, and chickpeas. A study in 2014 conducted by Wang and Associates connected low iron levels with hyperthyroidism. 85% of participants with Graves' disease showed improvement of symptoms when consuming an iron-rich diet. Rather than performing harmful invasive therapies and surgeries, a lifestyle change of diet can significantly help the patient. Low iodine diets have been proven to lower thyroid hormones in a variety of studies. For low iodine diet, it is recommended not to consume iodized salt and seafoods. The thyroid gland uses iodine to produce thyroid hormone. Too much iodine in the diet can increase the production of thyroid hormone, leading to further complications of Graves' disease patients. The patient should also limit their intake of grains, beef, chicken, and turkey. It is recommended to avoid eating out because there is no reasonable way to determine which restaurants use iodized salt. Frozen and prepackaged foods usually contain a high amount of iodine, therefore they should be avoided. A 2017 study conducted by Huang and Associates compared two groups of patients with Graves' disease during their anti-thyroid drug therapy withdrawal. One group was given iodine supplements for 12 months, while the control group was not. The iodine supplement group had a higher recurrence rate compared to the control group. This study supports that patients with Graves' disease should consider a low iodine diet. My mom was diagnosed with Graves' disease over 10 years ago. Her symptoms first consisted of fatigue and intense mood swings. She was given a radioactive uptake scan after her blood work showed the high possibility of hyperthyroidism. She was given a small amount of radioactive iodine. An hour later, the amount of iodine in her thyroid gland was measured with a specialized scanning camera. This was used to determine the rate her thyroid gland took of iodine. the amount of radioactive iodine taken up by the thyroid gland can diagnose the patient with Graves' disease. She goes to her endocrinologist monthly for blood tests that measures her thyroid-stimulating hormone. The dosage of medication she takes each month varies depending on the outcome of the blood work. Her current endocrinologist wants her to take radioactive iodine for radioactive iodine therapy, but she wants to avoid the procedure as long as possible. Lifestyle changes she has made include substituting pink Himalayan salt at home while cooking. Pink Himalayan salt does not contain iodine, which supports her low iodine diet. She has adapted a vegetarian diet after her diagnosis. Avoiding meat has significantly improved her symptoms of Graves' disease, as well as her other autoimmune diseases, lupus and rheumatoid arthritis. She says she attempts to avoid both dairy, milk, and eggs at all costs, and it helps that she doesn't like the flavor of either one. All the vitamins she takes on a daily basis are also iodine-free. My immediate family can notice when her thyroid is quote-unquote off because she is more irritable and sensitive to the heat. She's attempting a lifestyle medicine approach as much as possible and is attempting to avoid the radioactive iodine for as long as possible. She does, however, take medication on a daily basis in order to maintain her mood and appetite. She believes that the lifestyle change of diet definitely had an impact on her overall symptoms of Graves' disease. My best friend Natalie was recently diagnosed with Graves' disease this past summer. In June, we took a trip to Czechia in Europe, where she is from. A few days into the trip, she started to feel like herself. She's a Division I cross-country athlete and usually runs over 50 miles a week. She lacked energy to even run a mile. She was consistently parched and slept over 10 hours a day. Luckily, because she was a citizen, she was able to schedule an appointment and get blood work. She was diagnosed with Graves' disease. Because she was diagnosed in a European country, their treatment varied tremendously to the U.S. Europeans tend to avoid invasive surgery and medications at all costs. The doctors told her to stop taking her birth control and to adapt a low iodine diet. She was given a multivitamin to help with her energy and reduce the risk of bone fractures, which was a concern because of her high activity level. When she returned to the United States a few months later, she went to a naturopathic doctor and endocrinologist. The naturopathic doctor told her similar information from her experience with a Czechia doctor. She did a radioactive uptake scan at the endocrinologist and was put on a medication called methimazole. Over the course of 8 months, she said she has gained most of her energy back, but is still not at 100%. Because of her athletic career, she does not want to partake in any invasive procedures. She has a nutritionist who provides her with information on foods that are rich in calcium and iron, and she is told to avoid iodine as much as possible. In conclusion, educating patients diagnosed with Graves' disease the importance of lifestyle changes, such as diet, can directly impact the severity of their symptoms. Rather than solely relying on harmful conventional therapies such as radioactive iodine and thyroidectomy, patients should first attempt to make diet changes. The barriers to such education include the endocrinologist the patient is seeing, as well as the financial stability of the patient. For example, some patients may not be able to afford living on a low iodine diet, or on the flip side, some may not be able to afford a lifetime of thyroid medications needed after invasive procedures. Simple lifestyle changes can have a significant impact on one's life. It's important to recognize what your body needs when making such changes. No two people are alike.